Hey folks, it's Jim. A little trick that I learned a long time ago. I've had to deal with yellow fever, typhoid, typhus, dengue, malaria, I mean on and on and on. I've had to work in these clinical situations and in the field dealing with multiple cases. But anyway, the point I'm trying to make is how do you teach someone, how do we teach people not to touch their face, which is when we're dealing with any kind of transmissible disease, the one rule is don't touch your face. As soon as I put these gloves on, you know what happens? My hands go in this position. It's something about it because I was doing it a long time ago, okay? I don't want to touch my body. I don't want to touch my face. And even if I forget subconscious touching the face, we do it 500 to 1,000 times a day, right? Here's what happens with the glove. It's a different color and it registers the consciousness of my brain. And I stop. Just for that millisecond, my brain registers the color, something's different, and now I'm consciously aware again that my hand is approaching my face. Okay, so this is just one thing I learned a long time ago. Put your gloves on and be consciously aware and start thinking about, hey, I want to touch my face. And pretty soon, it'll take about 3 days, 4 days of practice, maybe 5, depending on how much you work at it, and pretty soon the habit will stop, okay? And I touch my face a lot. So, but once these gloves are on, well then I don't want to anymore. The other day when I was making a video, I broke protocol so many times it was ridiculous. Oh, and by the way, that video I showed you about my redneck getup, go look at what the South Koreans are wearing for triage. The exact same getup. You got the mask, right? You got your N95, you got your raincoat with your hood, and that's exactly what they're wearing to do triage over in South Korea. And the South Koreans are doing a great job on this, by the way, too. So if you want to see what an effective CDC should be doing, watch South Korea. They're doing it, okay? So what is our CDC doing? Hell, I don't know, who cares? But anyway, this is about learning not to touch your face. So put some gloves on. Right? Hopefully you've got blue or bright green or something to trigger in your eye, a register, before you touch your face and stop. And in a few days, you will stop having the 500 to 1,000 touches a day, okay? You will, you know, hopefully it will work for you. But this is the way we used to teach people. Just wear the gloves, and pretty soon as the hand's about here, my brain consciously sees the blue, okay, and it stops. It makes me get conscious about my hand. Whereas when it's just my hand, it's going right in because my brain is used to that. Doesn't need to register anything. But changing the color, it immediately flashes in the mind, right? So just think about that simple little trick. It's worked a lot, and it may help you. Just being consciously aware of your hands, right? Putting the gloves on. Sometimes you don't want to put them in your pockets. You don't want to do anything. Once the gloves go on your hand, watch how your behavior changes. Just watch. Your behavior is going to change, hopefully. Okay, and if it doesn't, change it, right? So that's a simple little trick that may go a long way during this period, right? Touching our face can quickly infect us, can't it? So let's work on that, and let's start right now. Even if it hasn't broke out in your area, let's get to work on that one training, not to touch our face during this period until we've completely washed our hands, right, with soap and hot water, and or disinfected, however you're going to do it. All right, Jim out.